Every year, thousands of people on Medicare lose hundreds, sometimes thousands of dollars. Not because they did anything reckless, because of paperwork deadlines, income brackets, and plan rules that nobody explained to them clearly. In the next 10 minutes, I'm going to walk you through the most common and most expensive Medicare mistakes and exactly how to avoid each one. Mistake number 1, missing your enrollment window. Most people get an initial enrollment period, 7 months centered on your 65th birthday. If you don't sign up for Medicare Part B during that window, and you don't have qualifying coverage through an employer, you can face a late enrollment penalty. And this isn't a one-time fee. It's added to your monthly premium for as long as you have Medicare. That penalty is 10% for every full 12-month period you were eligible but didn't enroll. Part D, your prescription drug coverage, works the same way. Go 63 days or more without creditable drug coverage, and you'll pay a permanent penalty on top of your premium for life. How to avoid it? Mark your enrollment window on a calendar the moment you turn 63. If you're still working and covered by a group health plan, confirm with your HR department, in writing, whether that coverage counts as creditable, so you know exactly when your real deadline is. Mistake number 2, getting blindsided by IRMAA, the income-related monthly adjustment amount. If your income is above a certain threshold, Medicare charges you more for Part B and Part D, and it's based on your tax return from 2 years ago, not your income today. Here's where people get tripped up. They retire, their income drops, but Medicare is still charging them the higher rate based on old higher income tax data. They didn't realize a big one-time event, selling a house, a Roth conversion, a final bonus check, could push them into a higher bracket 2 years later. How to avoid it? If your income has dropped since that tax return due to a specific life event, retirement, divorce, loss of a pension, you can file Form SSA 44 to request a reconsideration. Don't just accept the higher premium as permanent if your circumstances have genuinely changed. Mistake number 3, assuming Medicare caps what you'll pay in a bad year. It doesn't. Not original Medicare anyway. Part A and Part B cover roughly 80% of most costs, and there's no ceiling on your 20% share. A serious illness or extended hospital stay can add up fast. This is exactly why supplemental coverage exists, either a Medigap policy or a Medicare Advantage plan, which does include an annual out-of-pocket maximum by law. How to avoid it? Don't assume original Medicare alone is good enough until you've priced out what a worst-case year would actually cost you. Compare that number against the premium for a Medigap plan or the out-of-pocket cap on a Medicare Advantage plan. Then decide with real numbers, not assumptions. Mistake number 4, picking the plan with the lowest premium or the flashiest ad without checking the details underneath. A $0 Medicare Advantage premium can look unbeatable until you learn your specialist is out of network, or your regular prescription isn't on the plan's formulary, or you need a referral for care you used to get without one. How to avoid it? Before you enroll in or switch a plan, check 3 things every single time. Is your doctor and hospital in-network? Is your specific medication on the formulary at the tier you expect? And what's the actual out-of-pocket maximum? The premium is one line item. It's rarely the number that determines your total cost for the year. Quick pause, because if you've made it this far, you already know this stuff matters, and I don't want you to have to remember all 7 of these off the top of your head. I put together a free 1-page Medicare mistakes checklist that covers everything in this video. The enrollment dates, the IRMAA thresholds, the 3 things to check before picking a plan. Links in the description, no email required to grab it. And if this kind of plain English breakdown is useful to you, hit subscribe. I cover one Medicare topic like this every week, so you're not left guessing when the rules change. Now, let's get back into it. Mistake number 5. Assuming your plan will stay the same, so you never look at it again. Medicare Advantage and Part D plans can change their premiums, formularies, and networks every single year. A drug that was covered and cheap this year might jump to a higher tier or drop off the list entirely next year. How to avoid it? Every fall during the annual enrollment period, October 15th through December 7th, read your plan's annual notice of change. It's usually just a few pages. Compare it against your actual prescriptions and doctors before assuming your current plan is still your best option. Mistake number 6. Assuming you can freely switch back and forth between Medicare Advantage and a Medigap policy whenever you like. In most states, you only have guaranteed issue rights to buy a Medigap policy, meaning no medical underwriting during specific windows, mainly right when you first enroll in Medicare. If you choose Medicare Advantage first and later decide you want to switch to a Medigap plan, insurers in most states can ask health questions and deny you coverage or charge you more based on your health. How to avoid it? Before choosing Medicare Advantage over Medigap, understand that the decision may be harder to reverse later than it looks going in. Check your specific state's rules, since a few states offer broader guaranteed issue protections year-round. Mistake number 7. Not confirming how Medicare interacts with any employer, retiree, or spousal coverage you still have. Depending on the size of the employer and the type of plan, Medicare might pay first or second, and enrolling in the wrong part at the wrong time can create gaps or unnecessary premiums. How to avoid it? Call your plan administrator and ask directly, how does this coverage coordinate with Medicare? And what happens if I enroll in Part B now? Get the answer in writing before you make a change. None of these mistakes happen because people are careless. They happen because Medicare's rules are scattered across deadlines, income brackets, and fine print that nobody hands you all at once. The good news, every one of these mistakes is avoidable once you know where to look. Check your enrollment dates, understand your income thresholds, read your annual notice of change every fall, and never choose a plan on premium alone. That's it. That's how you keep Medicare from becoming the most expensive mistake of your retirement. For personalized guidance, contact your State Health Insurance Assistance Program, SHIP, free, unbiased Medicare counseling. If even one of these 7 mistakes was new to you, that's exactly why I make these videos. Medicare shouldn't require a decoder ring, and my job is to hand you one video at a time, so you don't have to sort through 50 pages of fine print yourself. 2 things before you go. Grab that free checklist in the description, so you've got all 7 mistakes in one place to check against your own situation. And subscribe if you want the next one. I've got a video coming up on Medicare Advantage versus Medigap head-to-head, and you won't want to miss it. Drop a comment and let me know. Which of these 7 mistakes almost got you? I read every one, and it helps me know what to cover next.